Also, the healthcare worker on the front lines every day now opening up on her very personal journey through a condition affecting so many women. Stay with us here on GMA3, folks. We are right back. And we're going to turn now to our next guest. Is a board-certified clinical nurse specialist, family nurse practitioner, and, oh, by the way, she hosts a show. It's called The Exam Room with Nurse Alice on YouTube, and for 23 years, she's been a source of strength for her patients during some of their toughest times.
And today, she is opening up about an important topic. It affects millions of women every day, fibroids. And here to tell us about her own personal journey is Nurse Alice Benjamin. And we're also joined by Chief Medical Correspondent Dr. Jen Ashton to be a part of this conversation. Nurse Alice, I'm going to start with you. You've been a nurse for 23 years there in Los Angeles. However, in 2015, we just mentioned you became a patient. So tell us how that moment, when you faced a big health scare with fibroids, how that changed your life.
Actually, it was pretty scary to go from provider to patient and now be in the hot seat, experiencing tons of pain, heavy bleeding, some anemia, and being faced with fibroids was something that was very scary for me. Although fibroids are not generally life-threatening, it can definitely negatively impact someone's quality of life, which it had done for me.
And Nurse Alice, you actually did see your OBGYN for some treatment options and management options. And so tell us what factors led you to make the decision you made to have those fibroids removed.
So I had started to experience longer and heavier periods, so heavy that I didn't really want to go anywhere during that period of time. And I was also having severe abdominal pain. I just wanted to lay down in a ball. And I had anemia, so my red blood cell counts were a little bit low. And I just chopped it up as to, this is something that women go through every month. And that wasn't really the case, because in 2015, I literally was getting out of the shower and I buckled over in pain and I had to call 911 and landed in the emergency room because it had gotten so severe.
Well, Dr. Ashton, you just mentioned what her options were and what management options you said. She decided to have them removed, but what are options available?
Well, I'm so glad we're talking about this. And of course, this is something that could affect up to 70 or 80% of women, much more common in African-American women. So it's really important when women go to their OBGYN, because we're the trained surgeons that can help address this problem, that they get all the options, not just the ones that OBGYN can offer himself or herself. So when you talk about those options, number one, expectant management. You can observe, you can do nothing, you can just follow signs and symptoms. There's two types of myomectomies, which is just removing those fibroids depending on where they're located. There's a hysteroscopic myomectomy, which is done through the cervix, usually an outpatient procedure. And then there's an abdominal myomectomy, which is a much bigger operation. There's something called uterine artery embolization, which is done by interventional radiologists, which may be appropriate for some women. And then hormonal therapy or partial or total hysterectomy. And so this depends on size, symptoms, age of the woman, desire for future fertility, just to name a few.
And Nurse Alice, we have learned that fibroids disproportionately affect black women. What do we know about, it's a pretty significant difference about why and how this happens and what black women need to know and can do about it.
Right, so I wish we knew the exact answer as to why black women have experienced fibroids more often, 2 to 3 times more likely to experience fibroids than other women, female groups, bigger fibroids, more fibroids, 3 times the rate of hospitalization, and are 90% more likely to experience fibroids by the age of 50, but we don't have an exact answer yet. We believe there's a genetic component, but other than that, we just know that your hormones and lifestyle behaviors contribute to having fibroids.
What's your latest checkup been with your doctor?
Yeah, so recently I've had a resurgence of my symptoms. So I went to my OBGYN, a doctor, and had a vaginal ultrasound. And so I do have 3 small fibroids. I'm going to see her again later this month, and we're going to discuss the options. I previously had them removed prior, and it's looking like that's something I'm going to do again, because the discomfort is something that I just don't want to go through. And because I'm still in my childbearing years and open to having children, I anticipate that I'll be having a repeat myomectomy.
And it is really important, as Alice is saying, to understand that if you leave the uterus in place, the fibroids growing back or new ones symptoms is always a possibility. So you really have to make that decision based on symptoms, based on age. And as I like to say to women, just because you have fibroids doesn't mean you have to treat them. It really depends if they're causing pain or heavy bleeding, like Alice is saying. So if they're not bothering you, don't bother them. But obviously, they are a major problem for a lot of women.
Dr. Ashton, thank you. And Nurse Alice, really, you come on here, you do this with your show, of course, and with your patients, but to share your personal story is certainly going to reach people and help folks and help us educate folks. So thank you so much for your time. We'll see you down the road, and good luck, all right?
Thank you.
Yeah, we'll be thinking of you, Nurse Alice.